Peripheral vascular and peripheral lymphatic system for nurses. Hello everyone, welcome to this video on the peripheral lymphatic system and peripheral vascular system. We will discuss the anatomy and physiology of these systems, their functions, health concerns, diseases, and disorders that affect them. Specifically, we will explore peripheral vascular disease, PVD, peripheral arterial disease, PAD, diabetes, and how to identify them during a physical assessment, as well as age considerations. Anatomy and physiology. The peripheral lymphatic system is made up of lymph nodes, vessels, and lymphatic organs such as the spleen, thymus, and tonsils. Lymph nodes filter lymphatic fluid that carries waste products, pathogens, and other substances from body tissues. Lymph fluid is not transported through the bloodstream, rather it is returned to the bloodstream via the lymphatic vessels. The lymphatic vessels are a network of thin-walled vessels that are located throughout the body and run parallel to the blood vessels. The lymphatic vessels contain small one-way valves that help to propel the lymphatic fluid forward towards the heart. As the lymphatic fluid flows through the lymphatic vessels, it passes through small lymph nodes that filter out waste products, pathogens, and other substances. Once the lymphatic fluid has been filtered, it is returned to the bloodstream via the subclavian veins, which are located near the collarbone on each side of the body. From there, the lymphatic fluid is transported back to the heart and lungs, where it is reoxygenated and circulated back to the body's tissues. On the other hand, the peripheral vascular system includes arteries, veins, and capillaries that carry blood to and from the heart. Arteries carry oxygenated blood away from the heart to the body's tissues, while veins carry deoxygenated blood back to the heart. Capillaries are tiny blood vessels that connect arteries to veins and exchange nutrients, oxygen, and waste products with body tissues. Function. The peripheral lymphatic system plays a critical role in the immune system by filtering out pathogens, foreign substances, and abnormal cells. It also helps maintain fluid balance by returning excess fluid from body tissues to the bloodstream. The peripheral vascular system's function is to deliver oxygen and nutrients to the body's tissues, remove waste products, and regulate blood pressure. Health concerns, diseases, and disorders. PVD refers to a group of disorders that affect the blood vessels outside the heart and brain. PAD is a type of PVD that affects the arteries that supply blood to the legs. People with PAD experience pain, cramping, or fatigue in the legs when walking or exercising due to insufficient blood flow, a condition known as intermittent claudication. This pain typically subsides with rest and can occur in the buttocks, thighs, calves, or feet. If you or someone you know experiences these symptoms, it is important to seek medical attention as early diagnosis and treatment can help prevent serious complications. Diabetes is a chronic condition that affects the body's ability to produce or use insulin, a hormone that regulates blood sugar levels. High blood sugar levels can damage the blood vessels and nerves in the feet and legs, leading to a condition called diabetic peripheral neuropathy, DPN. DPN can cause numbness, tingling, and pain in the feet and legs, which can lead to poor balance and falls. Identifying PVD, PAD, and diabetes during physical assessment. During a physical assessment, healthcare professionals can identify PVD and PAD by checking for signs of reduced blood flow in the legs, such as weak or absent pulses, cool or pale skin, and hair loss or thinning. They can also perform non-invasive tests such as ankle brachial index, ABI, and Doppler ultrasound to measure blood flow and assess the severity of the condition. To identify diabetes, healthcare professionals can perform a blood test to measure blood sugar levels. They can also check for signs of DPN, such as loss of sensation or abnormal reflexes in the feet and legs. Age considerations. As we age, our lymphatic and vascular systems undergo changes that can affect their function. For example, lymphatic vessels can become less efficient at draining fluid from body tissues, leading to swelling in the legs or arms. Arteries can become stiff and narrow, reducing blood flow to the body's tissues and organs. Therefore, it is important to assess the lymphatic and vascular systems in older adults regularly. Healthcare professionals can identify age-related changes and intervene early to prevent or manage health problems. Conclusion. In conclusion, the peripheral lymphatic and vascular systems are essential for maintaining the body's immune function, fluid balance, and tissue health. PVD, PAD, and diabetes are common conditions that can affect these systems, leading to serious health complications. Healthcare professionals can identify these conditions during a physical assessment and intervene early to prevent or manage them. As we age, regular assessments of these systems become even more critical to maintaining good health.